Good, good, good. Hello, Nandi. How are you?
Hi, I'm fine. Can you hear me?
Loud and clear. I can hear you. I can hear you loud and clear.
Wonderful, wonderful. I'm
All
happy to
right,
be
all
here.
right. Good to have you here. Good to have you here. All right, guys. So this is Nandi Ntiamwa Walker. Now, Nandi is a licensed clinical psychologist. That's going to be my first question, but let me let her breathe more. So, licensed clinical psychologist, and she does a lot of corporate work. I mean, in fact, she works with corporate wellness consultancy, and she works in International Maritime Hospital and also at Car Medical Center. And I mean, so she's a very sought after professional. I mean, and you can get that from what I'm telling you right now. She also works with a lot of religious bodies and corporate bodies as well, rendering mental health services. Now, if you've been if you've been following the news, you know how important mental health is. A lot of things have happened in the news recently that have brought mental health to the fore. And so, I mean, everybody needs some kind of mental support at some point. But this evening, we are going to focus on the cancer aspect of, or the impact of the cancer diagnosis on your mental health and what you can do about it. So Namdi is going to help us do just that. And whilst we are at it, and you can go and follow her as well. I mean, and her handle is very easy at Nandi. Once you start typing Nandi, you see the awesome lady pop up, and then you can just follow her right there. Okay, so Nandi, welcome to Wellness360 with me, Dr. Kelvin. I hope you had a great week so far.
Yes, I did. I had a good week. I hope you also had a good week.
Yes. I've been looking forward to tonight. So I mean, I'm excited that you're here, so we can learn so much from you. Okay, so like I said, my very first question, I already gave you a hint, so it's not going to come as a surprise. So, who is a clinical psychologist?
Okay, so basically, a clinical psychologist is we work within the health sector. So basically, when we are looking at the health sector, we are also looking at an aspect of health where we are looking at how the mind plays or have an impact on the physical body or our physiology. So we also have that. Hello, we also have that aspect of health where we believe that the mind also plays a very vital role in our overall well-being. And we understand the fact that the WHO defines health as a state of both physical, mental, and social well-being, and not just the absence of disease or infirmity. So there's an aspect of health where we also render services for people with mental disability going through any form of psychological or mental disorder like depression, anxiety, and all that. So the clinical psychologist looks more at behavior medicine, where we believe that we can design coping strategies or mechanisms to help individuals deal with very stressful or challenging events in their lives, and not just focusing on medication, because we also know that no matter how much medications you take, they still have some form of side effects. So why don't we also look at varied forms of coping mechanisms to help an individual deal with a difficult disability that the body or the individual, using some form of therapy, can also help the individual come out of a very challenging disability like depression, post-traumatic stress disorder, schizophrenia, grief and loss, broken hearts, among others. So it's a wide range of mental disabilities, and one of the specialists in the field are clinical psychologists and psychiatrists. The psychiatrists will look at the medication aspect, and we look at behavior medicine, looking at coping strategies and mechanisms to help people deal with mental disabilities.
Wow, thank you very much. But you were listing at some disease conditions, and I didn't hear you mention madness. Please.
So I think that we don't want to use. I mean, there's a lot of stigma around mental health based on our culture, our belief system. So we also know that using certain terminologies also creates a whole lot of stigma, and people would not necessarily want to get help if you use certain terminologies. That's why there has been a lot of changes with how we define or call certain disability. Not everybody is mad, but one way or the other, even when you're going through some form of stress, it is some form, you may require some form of assistance. It can be adjusting to a new environment, adjusting to marriage. It doesn't necessarily mean that you are mad. So, I mean, if you put it in that sense, it's not is stigmatizing and it's not accurate. You can't even call a schizophrenic patient mad because of the whole stigma around that terminology. So a lot of scientists and people are moving away from using the term madness. So I would encourage everybody to
Thank you for that clarification. Thank you for that clarification. Now, guys, our audience who are tuning, if you can hear us and give us some feedback, let's know that you can hear us loud and clear. Please drop a couple of hearts in the section, or just comment yes, we can hear you in the comment section, so we know that you so that we don't leave you behind. And so drop some hearts or type in the comment section. Let's know that you can actually hear us having this discussion. And if you have any questions regarding mental health, you can also begin to drop it in the comment section as well, so that we can pose those questions to Nandi, and then she will address it quickly. Thank you very much for that feedback. Okay, all right. Thank you very much for the feedback. Awesome. Okay, so Nandi, let's get started. Now, cancer is as a medical doctor, I know cancer is a big deal for a lot of people. And in fact, the diagnosis of cancer is quite traumatizing. So have you come across any cancer patients in your line of work, and what has been your experience with such people?
Okay,
particularly breast cancer, since you are in the breast cancer month.
Okay, so I worked at Sweden Ghana Medical Center at East Legon. That was in 2013. And that is a purely oncology center. So we're supposed to set up a mental health center so as to be able to help patients who were diagnosed with cancer, any form of cancer at all. So we saw patients with colon cancers, breast cancers, even cancer of the vagina, and a wide range of cancer diagnosis. So there we met a lot of people, and most of the cases too, I saw a lot of women with breast cancer. And during that period, most of the diagnosis for breast cancer was at the palliative stages. During that time, I think the owners or the people who were running the facility were from Sweden. So we mostly sit in the consultation rooms with the doctors. And then we also found out some of the challenges that some of the doctors had with treating cancer, where when they are diagnosed, first of all, with a disorder, people will resort to the prayer camps or see a pastor or a spiritualist. So instead of them seeking immediate treatment, it's like there was one woman who had breast cancer, and instead of her, going through the whole treatment process, she decided to see her pastor or spiritualist. And said she was going to a prayer camp. So I think the Swedish were very surprised, because they felt that the cancer was very aggressive, and she didn't really understand it. And then I think she took about 4 or 5 months to go and pray and get healing. By the time she came back, the condition had gotten to the palliative stage. It had metastasized and gone through parts of her body, and there was nothing the doctors could do than to just put her in palliative care, which would look at treating, using medications to lower the pain, and then also looking at psychotherapy, where people go through what we call the grief process of dealing with the fact that they have a short time to live and die. I think recently too, I also work with Accra Medical Center, International Maritime Hospital, so we see a lot of cancer cases at the wards, especially those whose cases are palliative, just to have a discussion with them to see the challenges with they being told that they have a short period to live. Sometimes people go through stages of denial, they go through anger, bargaining with God, falling into the state of depression, and then coming to acceptance. Sometimes they never accept. Others to decide to, look at the world positively, enjoy time with family, until the time comes and then they have to go. So at Kolebu also, I worked at the child health unit. I think I worked with you there. And I saw a lot of children who were diagnosed with cancer, leukemia, retinoblastoma, and all those cases. That's how I think I met you. And with all those cases too, it was very challenging seeing young children diagnosed with very severe terminal diseases, and parents who were going through quite a lot of stress, especially when the cases were palliative. And it was quite stressful for the parents, the caregivers, and the parents of those who had been diagnosed with a terminal disease like cancer. So it was walking them through the therapy session was not easy, because they had to accept the situation.
I can imagine. I mean, especially in the children's world. I mean, the cancer in children can be very devastating. But hey, it's very devastating. But so assuming a patient is newly diagnosed as having breast cancer, and I mean that person is referred to you, or you have an encounter with that person, what would that person be going through, and how would you support such a person, to cope? I mean, what are some of the techniques or something that you can help that person cope with whatever new reality she's faced with?
So I'll just have to walk back to the word cancer itself. The processes that cancer itself, looking at it as abnormal growth of the cells, more or less your body fighting itself. Something similar to an autoimmune disease, where at the moment there is not really a cure for the disease. It is most often than not managed. And we also understand the fact that everybody and their body genes and types. So even the cancer, if 5 women have breast cancer, the structures or the way they would occur may not be the same. The body is different. So we also know the fact that the treatment itself, there is no cure for it. And just like COVID, where you realize that even COVID, when we were told there was no cure, there was this whole psychological impact that came with the fear of the unknown. So let alone being diagnosed with a very serious and terminal disease like cancer, where it's even more, the more seriousness is that it's actually a genetic or a DNA defect, where scientists are doing so much to see if they can actually find an answer to what actually is causing this. So I think that for cancer, people, because of the fear of the unknown, and already when the seriousness of the disease itself creates a wide range of psychological challenges for people. Because as soon as, right from the process of being diagnosed with cancer, as soon as a doctor tells a patient, and I've seen it several times in the wards with the doctors, as soon as you tell them you have breast cancer, you have retinoblastoma or lymphoma, any form of disease, immediately you realize that people go through what we call the immediate clinical depression. They go through that state of depression right from diagnosis. So the cancer itself, it's even when you are told that you have the disease, it already comes with its own psychological challenges, because everybody knows that there is no cure and it's a very serious condition. It's not easy to even handle the disease, let alone going through the treatment process, chemotherapy, radiotherapy. People go through a lot of body changes. They lose their hair, their skin changes, a whole lot of things occur during that process. And even during the treatment, after they have gone through the treatment, sometimes there's a whole lot of body changes and dysfunctions that occur. And all those things, people go through a wide range of psychological issues. Even during the treatment, people go through PTSD. I have seen a woman who had a mastectomy. She had her breast removed. But even after that, the least headache, the least pain or pinch, she ran straight to the hospital. And doctors are saying, look, there is the cancer has gone to a state of remission. There's no cancer evidence of cancer, so relax. But she's very anxious. And sometimes when you talk to the patient, they tell you, look, what I went through, it was so traumatizing for example, me and my husband, that the least thing, I'm afraid I had to come to the hospital. So you realize that for this woman, she's going through some form of anxiety, already having some form of cognitive distortions, already catastrophic thinking has set in. And then you find out that she's already exhibiting signs of a mental disability that requires some form of psychological attention. So with all these processes, the psychologist comes in to look at the overall well-being of the person, because we also understand the immunology, the immune system of a human being. That when you have negative thought patterns, it also has an impact on the individual's overall well-being. So research even states that people who had HIV/AIDS or who were diagnosed with HIV/AIDS, it was not actually the disease that killed them, but it was actually the fear of the disease that killed even faster than the disease itself. So we also know that most often than not, negative thought patterns also have a negative impact on an individual's immune system. And your immune system contains your white blood cells that go a long way to fight diseases and bacteria and all those things. So if it is low, it also goes a long way to affect the overall well-being of the person. So the mind and body interact at that point. So we come in as psychologists to also look at, we understanding the fact that your emotional state has an impact on your overall well-being. We come in to look at psychological assessments, looking at the person's depression levels, the person's stress levels, anxiety levels. We look at whether the person has shown presence of PTSD, post-traumatic stress disorder. And then sometimes adjusting to a new body image can also be a problem. People have lost their breath, and they still have, because of the loss that they have, they develop what we call the body dysmorphic disorders. Sometimes people have low self-esteem and low self-image just because they've lost a part of them that for them it was very vital and dear to them. So it's very difficult to adjust to this whole change. So, I mean, we also come in to do psychotherapy, where sometimes when we identify cognitive distortions like catastrophic thinking, where the person always feels there's doom or death is coming, we are coming also to render some form of psychotherapy to change the mindset. Sometimes we also look at therapy, group therapy, as a form of treatment, because there are some cancer survivors. So when they meet in a group, everybody becomes each other's strength, especially for those who are newly diagnosed. They come in to also help them to look at the world positively. And so research has...
Let me stop you right there. I mean, so you said group therapy, so the newly diagnosed, they basically leveraging on the success story. So it means that people do come out. So when the psychologist intervenes and in all these situations, we get positive outcomes, right?
Yes. So for some people, for the group therapy, if, for example, you have a lot of people with, we've seen a lot of breast cancer patients who have survived, we can also actually do a whole group therapy with all of them, plus those who have been newly diagnosed. Comparing those who have been in the condition for a long time as against those who have been newly diagnosed, the psychological effects for the newly diagnosed is much higher than those who are already in it and are dealing with the situation. So most often than not, we try to create what we call the group or support therapy so that they also actually serve as a form of support to help them deal with the situation more positively than negatively. So yes.
But here's the case. We are in a culture where most people who are diagnosed as having cancer do not want the next person to actually know that they have cancer. So how are you able to get them in a group? Because if the average Ghanaian woman does not want the world to know that she has cancer. Can you hear me?
No, I can't. You were breaking. Sorry.
Okay. I was asking that in our culture, most women who are diagnosed as having cancer, or in fact, most people who are diagnosed as having cancer, do not want the next person to know that they have cancer. So how are you able to bring them together in a group for them to now share their stories to support each other? Isn't that challenging?
Yeah, it is challenging for most people, but during the therapy sessions, we have data. We keep data of clients and then their diagnosis. So because sometimes when you see a first case, for someone, the person is in a very severe state of, for example, breast cancer, but he or she, I saw a patient who, in spite of the challenges, she was pure palliative. She comes in and just to, clean her sores and all this kind of thing. But one of the things, even though she died about 5 years ago, every time that she came to my sat in my session, I was very encouraged because she saw the world very positively. She felt that the little time that God had given her, she would use it to enjoy with her son and her husband and then the close family members. For some people, when they come, they already see life as doomed. Their perspective of the world, they feel that God has disappointed them. They have extreme negative thought patterns and they emotionally break down. So most often than not, in such situations, we talk to all these cancer patient survivors with similar conditions and see if they would agree for us to do some form of group therapy with all those with that similar condition, so that they will serve as strength and support for others. And it's easier for them to call them in difficult challenges or in difficult times to talk to them. Yes.
Sorry,
my niece is behind me. Thank you.
Yeah. Anyway, But how important is family support in all this discussion? How important is maybe a husband or a partner's involvement in the therapy or even in the cancer treatment itself?
So for our culture, we understand the fact that researchers by Jechi and BT have said that Africans are notoriously religious, right? And religion, we eat and breathe religion. It forms every facet or permeates every facet of our way of life. So I'm looking at two aspects: family support and then the religious aspect. So religion plays a vital role, and you have researchers from Harvard with Professor Sean Acko identifying the fact that even when it comes to religious practices, worship songs, and listening to inspirational stories and all those kinds of things, there are positive practices of religion and there are negative practices. The positive aspects are what they are looking at: journaling, gratitude. They all form some form of treatment or therapy for people with these kinds of conditions. In our part of the world, we are highly collective in thinking. We are very, very collective. Okay. We derive strength. We are more of what we call the extended family system, as against Western or European countries where they are more nucleated. So, for example, in our culture, if a man marries, he doesn't marry just the woman; he marries an entire family. And one of the things, we even have the Enobwa, we have the Yubanti. Africans or Ghanaians are highly, we derive strength from each other. So when you read researches by Bukhari and Escasli, it tells you the high level of how social support plays a very strong role in cultures like Asians and in African cultures, including Ghana. So you find that social support plays a very vital role in treating cancer. But even with that, there are challenges, because sometimes if the case the cancer is there's non-remission. Now you have family members or caregivers who have to also deal with the fact that within a short period they're going to lose you. Okay, but then when family members.
Okay, you are back now. We've got you.
So based on our collective culture and our collective way of thinking, social support and family support is very, 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 very vital in treating any form of mental disorder or even a medical condition, based on a lot of researches that by Escasli, Bugra, and a wide range of scientists.
Great. So I made a few points as you were talking. So basically, you mentioned that when somebody is diagnosed as having cancer, any cancer for that matter, they literally go through the stages of grief, all the stages of grief, but not all of them get to the final stage of acceptance. Most would get there, but not everybody gets there. But with the help of the psychologist, it helps in getting to the acceptance stage and then moving on. Because if they don't get to the acceptance stage, then it means that their negative thoughts are then going to affect the outcome of their condition. And so it's important that we sort of close the loop. Or is that right?
Yes, we do our best to help people to get to the state of acceptance, but we also respect the fact that sometimes it is a choice, because people have their belief system, they have their own mental belief, fundamental belief that they are supposed to live long in life, and suddenly a diagnosis has cut their life short. It's not that easy, so they go through what we call the roller coaster. There are high days and there are low days. Some people may never get to that point of accepting the fact that this is it. They will still be bargaining and asking God for a second chance, and then they die. Others would spend a lot of time with their family and loved ones before they actually kick the bucket and all those kinds of things. Some people would make sure they complete all their bucket list before they go. It's all part of the acceptance stage. Others would still be angry. Yeah, others will still be angry. Others will still be depressed because maybe they feel the time they had so much to do. They are leaving behind so much, and they don't go through the full grief cycle. Yes.
I can imagine. Yes, but I think one thing is clear that psychological support is critical at that point when somebody has been diagnosed as having cancer. And so, I mean,
Very
basically,
critical.
we must all chip in, especially being African, where we are, like you mentioned, we are more of a collective than individual. So,
Yeah.
this is, I mean, this is from me to the audience. When somebody is diagnosed as having cancer, that's not the time to push that person away. That's the time to actually bring that person in, because the care and support you give him or her can help him overcome the challenge. So it's very, very important. Anyway, Nandi, thank you very much for this, I mean, you shared so much with us. But I mean, I want to find out if you have any final words. But before then, if anybody has any question and they want to put in the comment section, you can go ahead and do that so that we can address it quickly. But while we wait for any question, Nandi, if you have any final pieces of advice that you want to give to anybody out there who has gone through any form of psychological trauma, what should they do?
I think that we all go through challenges. There's a certain point in our lives that maybe we go through a challenge that shakes us, and we find it very difficult to resurface back. The research says that there is a thin line between normality and abnormality. Everybody goes through the state of grief or tears or pain or struggles, but others go and never come back again. And therefore, we are supposed to be more or less the light of other people, not to shun them away, not to stigmatize them. But when they really do need, not to make them feel as if they are weak and useless, but in difficult situations, I think that the best thing that we can do is to actually lead them to the right source of help to get them back and rehabilitate them back into society, which is also very, very important. Yeah.
Thank you very, very much. Thank you very, very much for that. So guys, you've heard it all for yourself directly from the clinical psychologist Nandi Walker. I mean, she's given us so much information. I think the summary of the whole show is that I mean, if you ever go through any psychological situation, anything that requires psychological support, there's help available. There's help available. You just have to reach out, and the help will be made available to you. You know, because we all go through it. We all tip to the left, tip to the right. You know, but some go and never come back, as she said. And so we really need to look out for each other, so that when we see the signs in somebody out there, we must connect him or her to the help that they need. Chris has a question though. Do we have particular one that kill, or all cancers do kill? Oh, okay. Well, all cancers can kill. I mean, that's why it's a cancer. It kills. They will kill you if you don't do anything about it. And so it's important that if you have a diagnosis of cancer, you need to get the appropriate treatment. You know. And so yes, get treated. It's very, very important. Don't. There's nothing like a small cancer. Every cancer is dangerous. So please get treated. You know. Yeah. And then once you are diagnosed, if you need, I mean, everybody. And Nandi, I'm sure you agree with me that in the ideal world, everybody who has a cancer diagnosis needs to see a psychologist as part of the treatment protocol. You know, I'm sure you agree with me on that.
Yes, right, from diagnosis. Yes.
Unfortunately, I mean, we are not in an ideal world, so we don't get that. But you know, that's why we are doing this session, so that you know that there's help out there. So that if you feel you're carrying the weight of the world on your shoulders as a result of your diagnosis, please reach out and get the help that you need. Nandi is open. And Nandi, how can people reach you? Where if they want to get a consult with you as a clinical psychologist?
Oh, okay. So I mean, they can just drop check my Instagram and drop a message, or they can call. We run a facility called Corporate Wellness Consultancy. So if they need any form of assistance, they can call the number 0542104742, and the HR person would pick their call, book them for an appointment.
Please repeat the number. 0542104742. All right, guys. So you can also follow Nandi at Nandi Walker. Write you on Instagram, drop her a message, and she'll link you with whatever resource that you need. This what you have to do is the free session. Like I always end by saying, not everything is free. So Charlie, when it's time to pay too, I have to pay so that we can keep the ministry going. All right, Nandi, thank you very much for spending the evening with us. It's been amazing. I've learned so much, and I'm sure that all those who tune in have also got some value from the time they spent here. We hope that we hope to have you here another episode, where we can talk about something else. but this month is
Sure.
cancer, so we're
Sure.
talking about cancer. Cancer is a very heavy subject. So, but thank you very much for taking us through, and
Thank
have a
you so
lovely,
for
lovely,
having me.
lovely.
Thank you. Thank you very much, Doc.
All right, all right. Okay, guys. So that's Wellness 360 with Dr. Kelvin, which usually comes on Wednesday evenings, every Wednesday evening, 6:20 p.m. Don't miss it next week because we're going to have another amazing time. We're going to learn something about ourselves. We're going to learn how to stay fit, stay healthy, and carry on with our lives because Charlie, once we have life here, we have to enjoy. So, and if you have any topic or any issue that you wish for us to discuss here on the Wellness 360, do drop me a message in my inbox, and we'll add it to the list because this is health is wealth, and so we need to try as much as possible to live a healthy life, so that we can push the boundaries and achieve the height that we were meant to achieve. So thank you very much for tuning in this evening, and I do hope that it was beneficial to you. Now let's go out there, share the message, and remember that the replay will be uploaded on my YouTube channel as Dr. Kelvin. So you can go look for that channel, subscribe, and put on the notification so that when it's uploaded, you get it and you can rewatch it and share it as well. So thank you very much and have a lovely, lovely evening, guys. Stay blessed. Peace. Great, Chris. We'll be looking out for you next Wednesday, so don't miss it. And go out and share the word as well. We are learning so much here on the Wellness 360.